Okay, let's try this again. Jump in if you have any questions. But if not, then we're just going to roll with it. It's per usual, just absolutely crushing this internet thing. Okay, so today we're going to talk about back pain that you may have and ways to prevent it getting worse in the future, or really ways to go into not getting it in the first place. So new babies are they're lovely and wonderful and hard and all of the things, but they're heavy because you, regardless of whether or not you carried your baby or you did not carry your baby, they are a now 8 to 10 pound bowling ball that you must carry around realistically all of the time. And so you're not used to that. Your body is not used to that. If you did carry a child inside your body is not used to having that center of gravity moved from your waist up into your chest or your arm or wherever you're carrying it. And if you did not carry your child inside of you, your body is not used to having to carry anything around with you all the time for any amount of time. And so the first thing that we do as parents is we adopt this little shake and sway, because it's really the best way to distribute your weight over your body for a long period of time while you have to hold something that's heavy and gets heavier by the minute. I think there's an old adage, like carrying a glass of water for 5 minutes is not going to be heavy. Carrying a glass of water for 3 hours is going to get very, very heavy. So your muscles are not used to it. Your body is not used to it. Your brain is not used to it, all of the things. And so the first thing that we can do as new parents is just say it out loud. I'm going to carry this baby on both sides of my body. Just say it out loud. If you say it out loud, hopefully your brain will hear you, and then you'll be able to do that. So for today's demonstration, this is our baby. This is a lot lighter than a baby, but my babies are heavy now, so we're going to do this. The first thing you do when you have a new baby is you snuggle it up, right? It comes up into your neck. Your arm goes up, your shoulder goes up. You have this cute baby. This is not a sustainable hold for a baby. You're shortening your muscles in your neck. You're hiking your shoulder, putting your shoulder at a disadvantage in that socket. You're tightening your bicep. If you're sitting, take that baby, plop a pillow under you, and drop your arm. Let the pillow do the majority of the holding. If you're standing, you can put your baby on their tummy, and that allows you to drop that shoulder down and rest yourself more comfortably. You can hold your baby a little bit closer to your chest while you do that nice little bob and weave. Or if your baby is a snuggler, that's okay too. You can hand on the bum, hand on the back. That allows you to keep that space in your shoulder open instead of hiking it up. Yes, we have to do things with our other hand, no problem. Switch shoulders. So your body is generally accustomed to one side being stronger, one side being a little bit weaker, just the way that we are dominant. Dominant hand on, dominant hand, dominant side on, dominant side. There are things that you inherently pre-children do. For me, I'm a righty, so it's the things that I do with my right. So this, for me, tight, controlled, always felt better. But the more you do this, the more natural it comes. So if you're doing this right out the gate, it's going to be more natural as you do it more and more. You will get more body control. And also, if you're right dominant and you're holding a baby with your left, you can do things that you wouldn't be able to do with your left hand. You can eat and hold a baby at the same time. You're going to be pleasantly surprised at all the things you can do while holding a baby. It takes some learning. So again, keeping that long neck, the shoulders out of the ears, that will benefit your back. Upper back pain, mid back pain, lower back pain. So the more forward you come, the more you get into your hips. I think we've talked about this sort of ad nauseum. You get the same effect that you get from sitting at a desk all day. So if you're holding a baby forward and up, you're going to be tight in your hip flexors, which weighs on your back. You're going to be tight in the front of your shoulders, which weighs on your neck and the back of your shoulders and your mid back. All of those postural changes can happen with the baby. Just like sitting at a desk. Baby wearing. I'm a huge fan. I understand it is not for everybody. So if it's not for you, it's fine. But you do get to position your baby in the center of gravity, and you get to do things hands-free. Obviously, don't hold your baby with your chin, but hands-free, center of gravity. And what that does is that it opens your posture. It allows you to do things bilaterally, which is that normal movement, using both sides of your body intermittently, interchangeably. And it keeps your baby right next to your heart, right next to your smells, right next to your warmth. They like it for the most part. Again, not for everybody, not a soapbox about baby wearing, but posturally speaking, if you are having a lot more back pain, this might be a comfortable place for you. Moms, dads, grandmas, grandpas, the whole kit and caboodle of caretakers, because this will be a place where your baby is closer to your center of gravity, which allows your posture to be better, allows your muscles to work in a more functional manner. Once they clear this baby phase, and again, real quick, we go, we hold, we snuggle, we bring forward, we're hiking our shoulders, we're doing all those things that go hand in hand. Again, go back to posture, my posture video. Do all of those nice open stretchy exercises. I want you in the doorway, leaning forward, opening your pecs, opening your biceps. Put your arms low and lean forward to open your biceps. They're going to get tight, and they're going to get tight for no other reason than you're locked in this sort of bent arm position. And just like anything else, if you were locked in that bent arm position, arm wrestling somebody for, I don't know, let's say the 6 hours that a baby needs to be held over the course of the morning, your arm is going to get stiff, your arm is going to get tight, even if it is relaxed sometimes, even if you don't have it in a full lock. So don't be afraid. Put a heat pack on that bicep. Open it up. Stretch your muscles. Open and closed throughout the day. When you have the opportunity to use your body and move your body, do it. Kids are a lot of work. They're heavy on our bodies. They're heavy on our posture. And so, that's worth its weight. Now, when they get bigger, this is where we really need to focus. This is where all of that sharing side benefit. So when you get used to holding your baby on your left side when they're tiny, the benefit will pay off in dividends when they're older. And so when you get an older kid, you end up with this posture. Your hips become unlevel. You are hiking your hip up to hold that kid in place, because this is an easier shelf than they're holding on, which they're not going to. Like this guy doesn't hold on. So we end up with this shift because we're so used to the rock. We end up with that shift over. We've hiked that hip and shortened the space between our rib cage and our hip, which tightens a lot of muscles there and can give you back spasms all the way up. You've come off of your other leg. So again, whatever your dominant side is probably the one that your kid's going to end up on most. So your weight bearing straight through your dominant side. Your other side becomes sort of a rotated kickstand because your pelvis wants to find its equilibrium, but you can't do that. And then you end up with like hip stabilizer deficits and glute medius deficits and all of the things that come along with pretty much just walking around, with that that hand on the hip teenage attitude, except now you've got 20, 30-pound weight on that hip. So getting used to carrying your child on the other side of your body when they're tiny will help resolve or sort of cut off some of those problems that you're going to run into as they get bigger. So as they get bigger, it's going to be much easier. You're just going to fall into habit. So you're going to have to say it out loud. I will carry my child on both sides of my body. I will carry my child on both sides of my body. They get to a point where baby wearing is out. It's either out for them or it's out for you, or physically both of you can't do it or you don't want to. Any reason. It's fine. But there are times when even my 5-year-old just couldn't possibly walk anymore. And so I have to pick him up. I mean, do I have to? No. Is it easier? Yeah. And so for those times, you have to think, where is my child going to be safest for my body? And to be honest, sometimes it's up here because I can put their load on my body and make sure that I'm strong and stable. He's big enough to hold on. Sometimes it's a piggyback. Sometimes it's asking them to wrap their legs around you and hold them from the front because this is where you're most strong and stable. And yes, sometimes it's on your hip. And yes, sometimes you're unbalanced and this is where you are. that 3-year-old, you're waiting in line at the bank and you have to go do something. You just need to do the things. And this is here. But when you get home, put them down. Stretch out your sides. Open your body up. Remind yourself that that is not where you want to be. That is not the place that you want to stick in. I will hold my child on both sides of my body. Open up your body. Carry your kid in the safest way that feels best for your body. If you're having pain, find a better way to carry them. If it's on the other side of your body, if it's right in the middle, if it's on your back and they're safe on your back. Because the less pain that you're creating for your body, the happier it's going to be. And the earlier you start doing that, the less pain you're going to create down the line. I get it. It is incredibly hard to remember to not do what's easiest, especially when they're tiny, because there are things that are so much easier to do. A gentle reminder, a sticky note somewhere, something that works for you. I will carry my child on both sides of my body. Will just help you be more mindful of where your body is in space. It will help you share the load so you don't get super tight on one side and have another side that's very, very mobile. It will remind you at the end of the day to just open your body up, because as parents, we live in literally in the space. The tiny people come in the space. We carry all of the things. We're used to moving it side to side and sort of juggling all the things and carrying all the bags and the kids. And so all of the benefits of opening your body up at the end of the day or throughout the day, using heat as a tool to stretch tight muscles, just natural movement. So your body is not supposed to be closed all day. So open, close, open, close. Just think about moving your body throughout the day in more natural ways, to try and offload what those kids are doing. Those sweet children. They're not here to ruin us, mostly. But yeah, if you have any questions, put them in the comments, shoot me a message. I'm here. I'm happy to answer. And thanks. Bye, guys.